November 14th is conducted as World Diabetes Day on the eve of Frederick Banting's birthday. Like incidentally, we all celebrate Children's Day also in India, Jawaharlal Nehru's birthday. This World Diabetes Day, this year's slogan is diabetes prevention and screening. So we are screening more and more individuals and finding that more and more people are diabetic. So, and in India, like the type 2 diabetes is occurring at a younger age, and people are developing complications also at a younger age. So to prevent these things, so we are promoting lifestyle changes and physical activity and other activities that help to reduce the burden of diabetes on the society. So you know that this type 2 diabetes, what I am talking about, is a metabolic and vascular disorder where it affects the eyes, heart, kidney and feet. If you control diabetes nicely and keep your HbA1c to around 6.5%, you can prevent diabetes complications. So the targets which I offer always are: number 1, A stands for A1C, where you have to get the HbA1c 6.5%. B stands for blood pressure, where you have to keep the blood pressure 130 by 80 millimeters of mercury. C stands for cholesterol, LDL cholesterol, you have to keep it below 100 milligrams. D stands for diet control. E stands for examination of eye once in a year and exercise. And F stands for foot care. If you follow the principle of this A, B, C, D, E, F, you can prevent many of the damages that can occur in diabetes. Diabetes, are several varieties are there, like we call, like the common types which we talk about are one type 1 as well as the type 2 diabetes, and the diabetes that occurs during pregnancy. So type 1 diabetes is a type of diabetes where there is no insulin in the body, they have to take insulin injections for survival. And type 2 diabetes means like there is insulin is there, adequate production is there, or marginal reduction in production, but the insulin is resistant. That means it is not doing the job it is supposed to do. So that is the reason, like type 2 diabetic people, they require tablets as well as sometimes they may require small supplemental dose of insulin also. And any degree of glucose intolerance that you see during pregnancy, you call it as gestational diabetes mellitus, where you have to give insulin injection to control diabetes so that a better maternal as well as neonatal outcomes will be there. Especially when you talk about the new things or advances that happened in diabetic field this year, I always like to tell two things. One is the new type of insulins that came to the market. The other one is the new devices, especially the insulin pumps. The new pumps that are coming are so fantastic. If the sugars are low, the pump stops working. So that type of advances are made as far as the insulin pump therapy is concerned.